Hi, everybody, and welcome to the latest installment in our People Over Politics series. This is our campaign's way of trying to reach out to people across Missouri, in this case, across the world, to learn more about how the COVID-19 pandemic is affecting you and people like you. And so I wanted to have the opportunity today to introduce my guest, Brenda Hatch. Brenda, thank you so much for being here with us today.
Great to be here.
And we can probably see there's a bit of a time difference going on. It's nighttime over here. Looks like it's early morning over there. Can you tell our viewers where you are right now?
I am in Incheon, Korea, which is just south of Seoul, and it's 9:30 in the morning here on a Saturday.
Right, and it's a Friday evening here. So we have a major time difference, but we really appreciate you taking the time to sit down with me and talk about this. So before we sort of get into what life is like in Korea right now, could you tell us a little about yourself and your background and how you're connected to Missouri?
Yeah, sure. I was born in St. Louis and lived there, all through high school. I'm not going to tell you what high school I went to because that's a
That's
Missouri
fine.
thing, but no, I'm not going to. Um, and we were living there up until 2018, and my husband got a job, and they offered to move our whole family here. So we've been living here since 2018, and we've seen coronavirus from the beginning. Yeah.
Maybe just tell us what that experience has been like overall before the coronavirus hit and that sort of changed everything. What was your experience like just being in South Korea?
It's been really great. We've really seen it as a huge opportunity to learn about this half of the world. I don't think I ever really thought about this other half of the world before we moved here. It's so foreign and different, but at the same time, people are people, and they're all wonderful. You just have to get over the hump of feeling like you're a foreigner in a strange land, and the language isn't the same, the alphabet isn't even the same.
Right.
You don't understand anything that's happening around you, but there's still mothers and fathers and children, and it's still families, and so once you get over the language barrier, you realize that everyone's just the same. So we've really settled in here, and we have many, many friends, and we've gone on amazing vacations, which would not have been possible if we weren't living here. We've really been taking advantage of the fact that we're in Asia and so close to so many other countries. I mean, Japan's only a 2-hour flight, and we go into Seoul all the time, or we used to. Um, and we've just been all over Indonesia and Cambodia and Laos experience so far, and the kids have really learned a lot about this culture and a lot about Eastern religions. They've been exposed to Buddhism and Hinduism and a lot of religions that they weren't exposed to before. And we will go to a Buddhist temple on the weekend because they're beautiful.
Yeah.
Um, so it's been really, really eye-opening and an amazing experience.
That's great. So, I mean, you obviously had to make the initial adjustment just culturally coming from St. Louis to South Korea. And then just, I guess, what, like a year in or so, suddenly now you're having to make another adjustment in terms of the coronavirus. Um,
Yes.
so, so obviously, here in the U.S., it sort of started to hit. I think the earliest we heard about it was in January, and then it's really been throughout the month of March. Things have really taken hold. So maybe just to put it in perspective, how does that timeline compare to the timeline that you've dealt with in South Korea?
Well, we were actually in America at the end of January over Martin Luther King Day,
Hmm.
and so we were in the United States when the first case of coronavirus hit Korea, but we weren't aware of it because it was not really hitting the news yet.
Hmm.
And then we flew back and immediately we're going on a vacation to Laos. So again, we weren't really watching the news or anything. And we were in Laos for about a week. And then we started seeing on our phones coronavirus popping up. And we knew it was Lunar New Year or Chinese New Year, which is the time where not only Chinese people all go on vacation, but anyone who celebrates Chinese New Year, which is most of Asia,
Hmm.
um, they all travel. And that's why we were traveling, because we had time off work and school. And we realized coming back through the airport that it would be dangerous for us to not be wearing masks. So it was the end of January, the 28th, I think, when we started wearing masks, just to fly home and get through the airport, because it was, it was major tourist season, and lots of people in those airports. So,
So you
and then after that, the kids were in school for only 1 week before they closed.
wow. All right, so then
Yeah.
you've had a little more
Yeah.
of a lengthy experience than we've had, I guess, with some of these restrictions and changes in your daily lifestyle. So, I mean, obviously, I'm sure you know here we've been social distancing. We've had a lot of our major businesses closing their doors. We don't go to restaurants or bars anymore. We get takeout and we stand 6 feet apart at the grocery store. Last week, we all started putting on cloth masks when we go out into public to try to protect ourselves and others from the spread of the virus. So those are some of the precautions we're taking. Maybe tell us a little bit about what your experience has been like in terms of what your government has required and what people are doing.
Okay. Well, Korea, it's they know everybody's cell phone numbers, and it's kind of like a message you'd get, like an Amber Alert. But starting starting in February, early February, they started messaging us over our cell phones, asking people to reduce their trips, into public. They tried to get us to stop going to restaurants, and stop going to bars, and they would send messages about washing your hands and wearing a mask and social distancing. But they weren't shutting down the bars. They weren't shutting down the restaurants.
Mm-hmm.
They were just asking people to, be safe and go home and social distance. So we stopped eating out. The last restaurant we went to was mid-February, and that was once. But really, that's the only time since the new year that we've been, since we got back from Laos, that we've eaten at a restaurant. It was one time. But we just, once we realized how contagious it was, we just stopped even ordering takeout, because the fewer hands that touch my food, the safer I feel.
Right.
But yeah, so the difference between the way Korea has handled it and the way America has handled it is that that first time the school closed because they had a patient that they confirmed had coronavirus, and they
Mm-hmm.
did contact tracing, and they figured out everywhere this person had been, and that included our local mall.
Mm-hmm.
And they sent out text messages and said, if anyone has been to this mall on this day during these hours, go home and self quarantine. And then they shut down the mall and they completely disinfected it, and it was open again in 3 days. They don't shut things down permanently like a lockdown. They shut it down to clean it. They tell everyone who's been there, go home and self quarantine. And then life goes on 3 days later when they finish cleaning it.
Mm, wow.
So it's because they're testing so much, and they invented the drive-through testing, which I think you have there now. Um, but they haven't restricted who can be tested. If you get in your car and you drive through right now, you can get tested,
Wow.
and they don't charge you anything. All your treatments are free. They don't check to see if you have insurance. They don't check to see if you're even a registered um, resident. So we have resident cards, alien registration cards is what they're called.
Mm-hmm.
And that allows us to have the national health care. but they don't check. They don't care because they're much more concerned that everyone who wants to get tested can get tested, and everyone who needs to get tested will get tested, and they don't care what your nationality is or whether or not you pay into the system
Right.
or if you're documented. They just want to contain this thing.
Right. Well, that's another one of
So,
the big differences is that here in the States, testing has been restricted really to people who exhibit symptoms or people who are in vulnerable populations and have possibly been exposed to people who are exhibiting symptoms. And that's because so far we haven't got the number of tests that we need to successfully test everybody in the population or in the way that you've sort of described. So that's another difference in terms of sort of the social distancing practices and the masks and those sort of things. Is that all stuff that you're practicing and doing, or is that a little different too?
yes, we're doing it, but I wouldn't say that, like in a grocery store, that people are really maintaining that.
Mm-hmm.
The aisles in grocery stores here are much narrower. They're not like super, it's not Schnucks or Deerbergs with super wide aisles where you can have 3 carts side by side. Everything's very compact
Mm-hmm.
here because it's an urban environment. Space is precious. So you can't really maintain that 6 feet, in a store. But people wear masks. Everybody wears masks. Everybody's been wearing masks from the beginning, and everybody wears gloves. Not surgical gloves. They wear. I I equate it to more like my planting gardening gloves, where it's rubberized on the palm side and breathable on the back side. And cashiers wear them. The stockers wear them. Every service person wears them. The delivery men wear them. Everybody wears these gloves, and I think it's part of the Asian culture that they naturally wear gloves anyway because they're always protecting their skin from the sun, but or their skin from anything.
Right.
But wearing gloves, and plus it's still cold here, and
Right.
I think yeah, I think you know, because it was winter when it started, everybody could wear their winter gloves and feel like they could go into a store and touch things and, pick up items and not feel like everything they touched had germs on it because they're all wearing gloves. And now I know people that are still wearing gloves. It's 45 degrees outside and people are still saying, that's cold enough. I can still wear gloves because if it makes you feel a little bit safer to go through a public space, and if you have to touch an elevator button or you have to hold a handrail or something like that, you
Right.
feel more protected with those gloves on. Yeah.
So as
So
far as your the rate of infection and the rate of recovery and unfortunately the rate of death and all those various things that we're all suddenly tracking now in our community, how has all of these steps worked or not worked in South Korea? What's the situation there?
yesterday we only had 27 new cases for the whole country.
Wow.
27. Yeah, it's pretty fantastic. Um, we did dip before, and then people kind of got relaxed, and then it got above 100 again. So this is kind of our second dip,
Mm-hmm.
and we're hoping that people don't get relaxed again. With the schools being closed kind of indefinitely right now.
Mm-hmm.
I feel like when you put a deadline and you say we're going to reopen on such and such a day, people see that date getting closer and closer and they start to relax, and not be as cautious because they think, oh, the end is near. But I
Right.
think when you have it indefinite like this, people understand that the risk is still there. They
Right.
can't relax, they can't lift those precautions because there is no end date to this, right?
Right.
This is for the foreseeable future. And I think people understand that. So
You mentioned a moment
so the
ago.
dip is 27. I'm so excited. 27.
That's something to celebrate. Well, I think we would all
That's
be
pretty
happy if our
fantastic.
numbers were down at 27 in the United States. We'd be very, very happy if we get down to that level, and hopefully someday we will be down at that level. But But you just mentioned the fact that the schools have been closed. I know that you're a mother. How is that working for you, or not working for you, as the case might be?
um, we are fortunate that our school was already very tech savvy, and as a requirement, our students up through, I want to say it starts in kindergarten, but I'm not exactly sure in the low end. Kindergarten through third grade, every kid has an iPad, and fourth grade up to high school, every kid has a MacBook. So we started off very, very well. Um, I'm not sure what's the right word. We had all the materials we needed because everyone had their own device, and
Hmm.
we have, Wi-Fi in the house. And so in that respect, we're very lucky because the teachers could immediately reach out to their students. Um, it was rough in the beginning, I'm not going to lie, even though the kids have many apps that they are used to communicating with their teachers
Right.
through. It was a lot. And I was getting 50 emails a day because I have 3 children, and I was getting updates on all 3 of them. And it was very overwhelming. It was
Hmm.
extremely overwhelming. But the school they've sent out surveys. They've asked for advice. How can we make this better? And they're constantly adapting their approach. And they have Zoom meetings now where they have online classes with all their friends, and they have online PE. They have online art.
Oh.
They have like live Zoom, art class, and PE, and regular math and English and all of that. But they have assignments across the board. This isn't just your normal math and English and science. They
Hmm.
have meetings with the guidance counselor to make sure that mentally they're doing okay and they can cope with what's happening. Um, they have they have a drama class, they have music class, they have Korean class, they have live Zoom Korean classes,
Wow.
um, PE. They have they have so many subjects, it's ridiculous. They have makerspace, they have design class, they have all these different classes. So it's not, they haven't reduced the curriculum at all. They haven't shrunk down what they're trying to get across. It's every teacher is giving them assignments and everything. So it's just been the biggest challenge has been the balance of handling all of that.
Hmm.
But
And
it's definitely improved. Yeah.
how do you feel like your kids are handling it? Are they feeling cooped up by this whole experience? Or they what's their reaction?
I don't know if it's just my kids, but they don't mind just wearing their pajamas all day and sitting on the couch and eating chips out of the bag. They're not that eager to go outside, especially when the air quality isn't always good here.
Mm.
Even before coronavirus, there were many days we had to wear a mask outside because of bad air.
Mm.
So dragging them outside, that doesn't sound very fun to them right now.
Yeah.
And it's not that warm. Like I said, it's only 45 degrees. So,
Right. Right.
um, yeah, they're totally fine wearing their pajamas and chilling
Mhm.
and eating all day long.
I think there's probably a lot of us in the U.S. who are also sitting around in our pajamas a little longer than we would like to admit, and probably eating a little more than we like to admit as well. So it's not too much different here, I don't think. Very similar kind of
Right.
mentality. But definitely talk to a lot of parents here who do find it to be very challenging to juggle the demands of their work, especially with
Hmm.
trying to raise their children at the same time. And basically, they feel often like they're having to homeschool their kids at the same time they're trying to do their jobs. So I know that can be stressful. You seem to be handling it okay, but a lot of parents are finding it stressful. So.
I think part of it is because we're 2 months into this already. So we've kind of hit our stride. But also, I came to a realization 3 weeks ago, maybe. I was having some chest pains, and I I didn't know what it was, but I was worried because of all, coronavirus. And so I reported, that I was having chest pains, and immediately got whisked into an ER and had all these tests. And as I was being tested and laying there on the gurney, I hope that my kids remember these last few weeks, um, with love and joy. And I don't want them to remember me yelling at them and getting all stressed out about homeschooling. And like if the chest pains were serious, and if they were coronavirus or any other thing, and they had to put me in isolation, and
Mhm.
then I could never see my kids beyond that point, I thought, okay, so the last 2 weeks that I've spent with them nonstop would be the last memories that they had of me. And I don't want those memories to be of me screaming at them and saying, do your work, and why aren't you doing your assignments, and why is this so hard, and all of these things that I'm sure all these mothers are yelling, because I was going through those moments as well.
Yep.
I've really had to kind of remind myself that this coronavirus is not selective. It's hitting everybody. And
Hmm.
it could be any one of us. And I want my kids to remember this as a happy time with us, and not a scary time or a stressful time, or, you know, I don't know. It's it's made me kind of relax a little bit and not take this all homeschooling thing too seriously. Because we just have to remember to love on our kids, and
Hmm.
um, you know, just take advantage of this time. I said, as someone in a Facebook post a couple weeks ago, I said, this might be the longest you've ever spent with your children in
Right.
one continuous stretch. Because
Right.
most mothers, at least me, we only had 6 weeks of maternity leave, right?
Right.
That's the longest stretch, was when your baby's first born. And we're past 6 weeks now. I've now spent more than 6 weeks nonstop with my kids. And I have to I have to realize that I'm now getting a chance to know them as people,
Hmm.
right? I have a teenager. Like, it's really hard to know your teenager, you
Right.
know? Yeah. So having all this time to get to know them and hang out with them and talk to them, it's a really good time right now. Even though there's coronavirus, I think we should really just count our blessings.
Well, that is the silver lining, I'll say. As many people I've talked to who are trying to figure out how to juggle everything at the same time, everybody also says it's wonderful to have this time to spend more closely with my family, with my kids. I just feel like I'm sort of, it's causing me almost to reevaluate some of my priorities and what's important to me in my life. And, when we have events like this in our lives, they're always going to do that. But this one, especially, I think, is causing a lot of people to think about what's important. So, I'm glad that you've got that perspective already, and maybe we'll all be there in a month from now, and we're 2 months into it. I think some of us are still in the phase of yelling at our kids and being a little frustrated, but maybe we'll settle in and figure out how to handle it as time goes by.
I really feel for everyone who lives alone. This must be the hardest time of their lives. And I think, moving forward, mental health issues are going to be really forefront.
Yeah,
Um,
for sure.
People, that's why I'm so appreciative that the school even has guidance counselor classes, and talks about coping mechanisms, because I
Yeah,
think everyone needs a strategy of how to cope with this, whether it's virtual happy hours, virtual trivia nights, virtual costume parties, virtual whatever,
right,
as
right.
long as you can face to face with people. And yeah, it's definitely lifts the soul. I think a lot of people feel really helpless right now, very powerless,
Yeah,
because this is an enemy you can't see, and you can't fight it with normal weapons, right? And um,
well,
it's scarier than zombies. It's just,
well,
but you can't see it.
you can't see it, and like you said, no one's safe from it. It's not like just no matter, it doesn't know how old are you? How young are you? How healthy are you? How not healthy? What county do you live in? Who'd you vote for? How much money do you make? Like, it
What
doesn't know
high
any of that
school
stuff,
you went to?
right? Right. Doesn't know any of those things. Just knows that you've got human DNA, and if that's the case, it's coming after you. So, so yeah,
Right.
people are scared of that, but I do think that they like you said, they want people take pride in their work. You know, they take pride in doing something that helps other people, and a lot of people who are in a position where they're not working or not able to work, I think they want to find a way still to like feel useful to other people, which is amazing. Like that's an amazing quality of human nature, that when we all could be huddled up in our homes, scared and worried, we're actually looking out the window being like, who can I help? Is there anything that I can do? And that's, I think, actually beautiful and like a refreshing thing about human nature. You don't always see that. So
Absolutely.
I
Oh,
won't.
wait, watch. Can you see this?
What? Oh, I can. There you go. Very cool.
That's
That's
that's one of the emergency alerts. Do you want to see what it says?
sure.
I
Yeah.
have to take a picture of it and then Google Translate it because I can't read Korean. Let's see what it says. Then you'll get a good sense of the kind of stuff that they send us.
Wow.
Yeah, and it's loud like that.
It's just like the Amber Alert sound that we get. You're exactly. That's a good way to explain it.
Yeah. Okay, let's see. So it says, to prevent the spread of infectious disease, we will announce the closure of the Incheon Grand Park. So please participate in the social distance movement. Yeah, so they've been having an issue with it's cherry blossom season. And everybody loves to go outside and get their pictures taken in front of the cherry blossoms. And it's causing huge crowds. And they're trying to get people not to do it. So they're shutting down the parks. So the parks with the most cherry blossoms, to get people to stop coming in droves. And actually Jeju Island, which is part of South Korea, it's south of South Korea, they have these beautiful canola flower fields that everybody flocks to this time of year to get their pictures taken in front of the flowers. And they're actually raising them. They've got the tractors out and they're cutting it all down because they're trying not to get people to come and look and
Wow.
take pictures, because they're trying to keep the tourists away.
Yeah.
So
Wow.
yeah.
Well, this was really illuminating and helpful. I have to ask you, so what is it that you miss the most about Missouri, having been gone now for a while? What are the things that you get a hankering for or just miss?
Um, I miss the long trail rides and hiking. Feel like, camping. I I miss like float trips
Yeah,
and
right.
yeah,
Float trips are
yeah.
not a thing there. That's not a South Korean tradition.
They have whitewater rafting, but my youngest kid is just not old enough to do that yet. I really look forward, or I did. I don't know if it's possible right now, but coming home and taking my kids on a float trip,
Yeah,
that would be really fun.
that's a real Missouri specific thing to miss. So
It
yeah,
is.
that makes sense.
Yeah.
Well, this was so great. I have to thank you again for taking all the time to talk with us and share your experience. I know a lot of us are, spending a lot more time on our computers and trying to learn more about this, and feel like getting a little bit of insight from you, being a little further through the process than we all are here, hopefully help to put our minds at ease and give us a better feeling about things. So thank you so much for taking the time with me. I really appreciate it.
Yeah, it was fun. Thank you.
And thank you to all our viewers as well. I hope that you found this to be educational, interesting. If you want to learn more, follow our page on Facebook. We'll be doing more of these interviews as the weeks go by. Our campaign is all about putting people ahead of politics, which is more important now than ever. So thank you again. See you next time.